Welcome to the Whole Career Podcast, where we explore the world of healthcare careers with AdventHealth professionals. I'm your host, Phil Houghton, and I'm excited to take you on a journey of career exploration, development, and success. At AdventHealth, we believe in caring for the whole person, which includes supporting our team members' professional growth and development. In this podcast, we'll be highlighting valuable career information, resources, and advice to help you succeed in both your professional and personal life. Each episode will feature conversations with AdventHealth professionals who will share their personal career journeys, insights, and perspective on various healthcare careers. From nursing to technology to leadership, we'll cover a wide range of topics to help you stay informed and inspired. Whether you're just starting out your career or you're a seasoned professional looking to take the next step, this podcast is for you. We hope to empower you with the knowledge and tools you need to grow, succeed, and make a positive impact in your field. At AdventHealth, we believe that we are greater as a whole, and we invite you to join us on this journey. So sit back, relax, and let's explore the world of healthcare careers together. Welcome back to the Whole Career Podcast. My name is Brandon Strawn, and I'm accompanied by my co-host, Phil Houghton. Today, we have an amazing show in store for you. We are joined by Sharon Wagner, who is an RN in CFD and home health, and we are also accompanied by Aleta Bautista, and she is a physical therapist in home health and CFD as well, which is the Central Florida Division of AdventHealth. Welcome, Sharon, and welcome, Aleta. How are you guys doing today?
Very good. Good morning to you.
Good morning.
Awesome,
Thank you.
awesome. So before we jump in, we usually like to just give the audience just a baseline understanding of what you do, what your role is. And so I know we're talking all things home health today, but if you could just give us an understanding of what you do for work, and then also, as well as you can go after it. Yeah.
So as a nurse, we in home health, we go out and we visit patients, patients that are usually discharged from the hospital or referred from a doctor. And our goal is to keep them out of the hospital, keep them well, teach them about their disease process, do wound care, you name it. And yeah, that's what nursing does. And then
Awesome.
we work closely with therapy and occupational therapy and
Yes.
all the therapists.
Yeah. So I'm a physical therapist with AdventHealth Home Health, and I do the evaluations. I'm a case manager for patients who need physical therapy, basically trying to rehab them back to their prior level of function after their hospital stay. You know, a lot of them are weak and all that. So we do a lot of hands-on therapy in the homes until they regain that independence or they're ready for the next level of care.
Nice.
So,
I love that. And Brandon and I, at one point in time, were both recruiters, so we know so many different avenues that you guys could have went down in PT and being an RN. What led you to home health?
for me personally, uh, by the time I joined Advent Home Health, I have had maybe about 13 or 14 years of PT experience before in all settings: home acute, outpatient, rehab, skilled nursing. Uh, but I wanted somewhere to work where I had a little bit more flexibility because I had young children at that time. I needed my schedule to kind of afford me, some free time if I needed to during the day, and then pick up where I left off, because um, my kids were heavily involved in gymnastics at that time. So their practices were like just all over the place
Right.
every day. And so I had to be able to pick them up, take them from school, take them to practice and all that. And home health knew that it would allow me to do that. And it did. And until they finished their gymnastics career. And
And now you're still in
You're
home
still
health?
there.
Oh,
I'm
nice.
still in home health. Yeah, 22 years and going strong. Yep.
22 years. Awesome. And Sharon, what
So,
about you? What led you to home health?
so I worked in a hospital setting in New Jersey for 15 years back in the 1900s
Oh,
till 2014, 2013. And then same. I have an older daughter, and at the time being in the hospital, I missed out on a lot. So with my two sons, when I had them, I was like, yeah, like it was very hard to find someone to pick them up from school, daycare, with my husband working. And so someone said, "Hey, why don't you try home care?" And I was like, "Home care?" So I was like, "All right." So I had an amazing orientation. And I was honestly, I was like, "Who kept this secret
I
from
know,
me for
right?
so
Me
many
too. I'm like,
years?" Oh
Really?
my gosh. The flexibility is
yes.
amazing.
I mean,
I mean, it's not 9 to 5. You can I'm home even now to get my daughter off the bus at 3:30, and I kind of have to.
Yeah.
And that home health gives you
mhm.
that flexibility. And I was like, this is it.
Mm.
So, I mean, I tried to venture off to office setting one time, with Advent Health medical group, and I was like, not for me. I need to see patients. I would need to be outside.
Right.
So,
No, I love that, and you mentioned like who kept the secret, and then I saw you had a reaction as well. So just wondering, like, do you feel as if when you had graduated and you're working as a PT or graduated as an RN, was there a lot of talk about home care? Was
not
it
for me, no.
not while you were in school, right?
Mm-mm.
I wonder, do you know why that might be?
Well, for nursing, there's so many different avenues, and a lot of times you have to get that 1 year experience, med
Okay.
surge, and then once you're in the hospital setting, a lot of the mindset is you stay in the hospital until you get your experience and you can move on. It really takes someone that or a concern like I can't do the hospital, I'm getting burnt out. You just have to know someone to say, hey, look, why don't you try this?
Right, right.
And that's for any setting, but for home health, if you have kids especially, I think it works. It's just flexible enough, and the patients, honestly, they're home now, so they're friendly. They love seeing you. They want to. Most of them want to learn. They want to get better, and they want to stay out of the hospital. And it's a different atmosphere when in the hospital. They
Yeah.
I think for me as a physical therapist, there is, a certain prestige about working in like a when you first get out of school, prestige in working in a big institution in a facility, like sports medicine. A lot of new grads, tend to gravitate towards something like that. Like, yeah, I work for this and I work with these athletes and all that. Or working in a rehab setting, and people tend to think, wow, yeah, that's amazing work, like, why would you want to work on your own, like in home care, so that's just not something in the radar for a lot of people, like new grads or those who don't have as much experience yet. And so I think that's why home care in general is not as spoken about, so
Makes
I
sense.
think I've heard both of you guys say flexibility a few times,
Right.
Oh
but
yeah.
truly, what does flexibility look like? What is I know you said not a 9 to 5, so what does your day look like? What are your hours look like?
So for me, the night before we call our patients, it doesn't take too long. Um, Advent Health, what's great about Advent Health is we're broken up in different teams because Central Florida is so big. We're both in the pink team, so we're in East Orlando, Oviedo. We're not Oviedo and then have to drive to Apopka. So we're in that small area, and so if my kids have something at school, I can work, or if I have a doctor's appointment, I can work around, I can schedule my patients around that, still get all my work done, clock in, clock out. Like, if I have an appointment, we can do that. My daughter needs to get off the bus at 3:30. I don't like her walking home by herself.
Right.
So I try and get there. I mean, sometimes I can't, but I mean, it's really, you're not locked in the hospital. You don't clock in at 7 and you're home at 8 o'clock at night.
Right.
for me, I think my day, like you said, I would prepare the night before, call patients, and make sure to let them know that I'm coming. So then the following day, I just go about. If I said I'm coming at 10, I see my first patient at 10, and then it just goes on. And because it's a smaller area, then I'm able to like really plan whether I'm going to be there at 10, 11, 12, whatever. And then my day would just go on. If I'm now, my kids are grown and they're not even home anymore. And so, but I'm a caregiver for my mom. And so she has medical appointments. So if I schedule my patients, the first patient at 10, then my mom has a 1 o'clock appointment, then I'll keep that open. I clock out, clock back in, do my mom's appointment, clock back in, and do the rest of my patients. The difference, though, with home health is that the documentation definitely is something that would carry over to working in your own home. I guess that's why it's home health. You also do work at home,
Right.
but because that's just what you do. That's just part of home health. There's no way that you could ever finish documentation in totally 100% in the patient's home. And so you get home and you still have to set aside time where you finish up, your documentation for the day. And then and that would mean for me different times. I could be working from 7 to 9 in the evening, and if I had something to do, if I wanted to meet friends or whatever for dinner, then that would mean 9 to 11 maybe, or 9 to 11:30, depending on how much
Right.
paperwork I have left. Sometimes I can work, like, after getting home, I can do my paperwork right away and be done by 7.
Right.
And it all adds up, and we clock in and out, and so you are compensated for the time that you work. So as long as you are disciplined enough to complete your documentation for that day, then there's nothing left. Then the next day comes again and you do the same thing.
Yeah,
Yeah.
and I do the same. At about 9 o'clock is my clock back in time. Do my work,
Right.
finish it by probably usually 10:30, 11, and
In the evening. Yep.
because my kids are all in sports, so this one goes here, here, here. So,
Right.
I'm done at basically at 3:34, but I'm not really done.
Right. Right.
Yes.
One thing that I will say, it seems like it takes a lot of discipline to make sure that you're
Absolutely.
getting your stuff in.
Yeah,
Yeah,
absolutely.
especially being almost like a lone ranger out
Yeah.
there,
Yep.
going from place to place. So
Yeah.
You have to, because it can all catch up with you, and I've had that even from when I started with Florida Hospital, when it was all paper, like paper.
Paper charting.
Absolutely.
I
Oh,
started
Every
no.
charting.
paper
I
chart.
can't even fathom that.
I
Yeah.
Please, I don't even remember how I did it, but
Yeah.
yeah, you had to submit it. For every patient that you saw, you had to submit your paperwork, and then pick up forms from the office. Bring it. That was like, and but still, you had to get it done. You're disciplined, like I said, because no one's hovering over you,
Right.
like in the hospital or a skilled nursing facility or a
Right.
rehab, where your supervisor is right there. Are you doing charting?
Yeah.
You don't have that, so you're really on your own, and you really have to have that discipline to just be on it,
Right.
be on
Yep.
top of it.
Yeah. And what do you think now it kind of makes sense when you were mentioning, Sharon, about not it not being talked about in school and needing that year of experience, and maybe even needing that for some of the younger individuals, someone who might not be in a second career student. They need to learn those skills, right, of just working with full autonomy, right, being
Yeah.
able to make those executive decisions or those split second decisions about, okay, do you give this type of care, that type of care, and especially being out there on your own. I would imagine you would need to be somewhat of a strong nurse and strong therapist.
Absolutely.
So I guess if we could just talk about what were some of the things that were able to build you up, maybe in your previous roles, for it to experience and to go out there and say, I'm strong enough and confident enough to give care on my own. And we'll start with you, Sharon.
So for nursing, you have to have a strong assessment skills. You have to have that eye for something's not right here. Let me, do vital signs, assess the patient, and I get a lot of that from experience. Um, the patients are coming home sicker from the hospital, so you have to be prepared for anything. And we get a lot of calls from the therapists too, like, "Hey, the blood pressure's this," and we call the doctors a lot. We try not to utilize the ER if we don't have to. There's urgent cares that now come to the home, which is amazing. But yeah, you need a strong assessment skill and have an eye for something's not right, especially if you're seeing that same patient over time. We typically see patients in a 60-day period, like once a week, maybe. And you can kind of sense if something's off if you're seeing that same patient.
Yeah. Aleta?
For me, one of the biggest things I think that helped me to become a home health therapist is really when I worked in skilled nursing or rehab. Um, I was used to having an aide right beside me. If it was a bigger patient, and they're all bigger than me, I mean, you know, so um, as soon as I needed help to get somebody up, that my aide was right there, or my peers would, somebody to ask if there was anything that, maybe I might be missing and all that. And so the techniques of treatment and transfer training and all that, that you've learned throughout I've learned throughout my practice before becoming a home health therapist, I really think that that helped me. The other thing is that I've learned to improvise a lot, because I don't have equipment, I don't have parallel bars, I don't have, yeah, those things that I used to use in a rehab setting. So the only thing I can bring are, maybe some free weights, ankle weights, maybe some TheraBands and all that. But a lot of the times, I've had to kind of improvise again, with, and I use a lot of the family members, to help me out in teaching and training and all that. And I think working in a group setting is great to start off with, but you also have to think about what you can do also on your own. And if you are confident enough to impart that to the patient themselves, because that's what they need to learn. They need to learn how to function independently,
Right.
and that's why the home setting is such a great setting, because um, if you teach them in a rehab setting, well, the bathrooms are super wide.
Right.
Then they get home, they're like, oh, what do I do? They
Right.
like, nobody taught me this. Like, yeah, nobody, because it's a different experience.
Right.
They taught you how to transfer when the wheelchair can go all the way into the bathroom,
Right.
but you can't do that here. Wheel walker doesn't even go into your bathroom, so a lot of these things you learn, and it's like you find out, like, yeah, it's a total change in mindset. This is not just the ideal setting.
Right. Right.
This is your environment. You have to learn what you need to do to function in your own environment again.
Yeah, that makes a lot of sense. I think as we're not clinical, so when we think about like the hospital, when we think about healthcare, we're like, well, if you want to get treatment, if you want to get the best of the best, you just go to the hospital or you go to that healthcare setting, that building that we've created, right? Or we've said that is where you receive treatment. I don't think we automatically assume like your home could very well be the best place that you receive treatment. And I'll even say my wife, she's a speech therapist, and so she does home health as well. She does home health and she does um, um, inpatient or private practice. But she mentioned to me one day she works peds, and she's like, some of the kids that their parents want them to do in home. Excuse me, they want them to come into the office or the practice. She actually recommends for them to do it at home because she sees that they would probably adapt better and grow much faster from just being in their own setting. And so that's interesting that you kind of say the same thing for PT and also nursing as well.
Yeah, and I'm sure all of this takes time and it's a process. And day one you walk in there, they're not trusting it of you as day 50 or something like that. I'm curious how you guys build that rapport with your patients and you're able to tell those small things versus like day one when you walk in there versus day two, like, oh, Mrs. Johnson, I see you're not walking right, or I see this is not correct.
For me, when I love being a home health therapist, because like Sharon said earlier, you go in and they're in their own environment and they're more relaxed, right? I worked in acute care before, and in the hospital they're so anxious. It's like, how long am I going to be here? What are they doing and all that? And a lot of the times you don't have answers. But when they're in their homes, and they have certain questions, you have a little bit more of an idea on what they need to be doing so that they can really get the outcomes that they want. So the way that I kind of put them at ease is, as I look around, well, initially when I first called, my very first call the night before, when I tell them, um, I'm Aleta, I'm your physical therapist, and I have an order to come see you
Right.
in your home tomorrow, and they already, a lot of them know, of course, that they have home care orders, right? But when they hear those words, that I'm making it more personal, that well, I'm the PT, I'm gonna come to your home. If you tell them, I'm your physical therapist, I'm gonna be coming to see you, and we'll evaluate and all that. They're already put at ease, and when I get home when I get to their homes, and I see, their setup. Sometimes just seeing a picture of maybe a family picture, oh, look at this. Oh, are these your children? Oh, there's, how many do you have? And they become really comfortable right away. Sometimes you get to the homes and they have curios of their collections of elephants or
Yeah.
whatever. And so you start to talk about that and say, oh, I love your collection, look at this. And they want to get up and they want to show you, and and then that's part of your evaluation already. Oh, there she is, she's walking. Oh, not good, she forgot her walker there. So a lot of those things, you put them at ease, and they see that you are truly interested in them. I think that they start to look forward to your visit the next time. You weren't just there, okay, sit down, let me ask you this question, da 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 da. No, you really build rapport. And I think the home setting allows for that, because in the hospital, everything's strange. That's not their environment. What kind of small talk can you say? Oh, hey, you have water here, whatever.
And they see a different person all the time.
Exactly.
We try and keep the same clinician each time. It makes it, if you have different clinicians, then the patients, I think, are a little uncomfortable. Like, oh, I have another person coming in, but we tend to keep the same patients. But same, I mean, you just be kind and nice. I mean, you're still a guest in their home.
Right.
I know some nurses are more firm than others, and therapists. But if we're there, we set goals with the patients. We're there to reach their goals, since we're in their setting, it's easier for them and easier for us, but the same. I'll I'll look at a picture or a curio cabinet and be like, "Oh, you have a lot of elephants. What's the story behind that?"
Right. Right.
And they love telling stories. Oh, the patients just love telling stories, and I think that does open up. They're more. They'd like us to come.
Yes.
I have one his daughter just texted me the other day when I texted her when I was coming. She goes, "My mom loves when you come." So yeah, anytime's good. Just stop by. I'm like, okay.
I
And it
think
makes me feel good. I'm like,
Yeah.
oh,
I think
my job.
another thing is the goal setting. I have patients who have very specific goals of mobility. They say, I have to be able to go to my mailbox, walk to my mailbox, because no one will get my mail for me. And so when it's like that, well, that would entail you stepping down 2 steps. That means you'd have to walk down your driveway.
Yeah.
That means you have to be able to kind of step down a little bit to your mailbox. And so it becomes a little bit more personal, and they know that, oh, that's why we're doing this. We're going to do this. And so then when I say, okay, we got to work on this exercise so that you can step down and up and step down and up. And then when they say, oh, I don't want to do that, remember, you got to go to your mailbox. You
Right.
told me before, you got to go to your mailbox.
Yeah.
And say, okay. And then so when that's the result after a while of therapy, when that's the result, look at you. And then they tell you the next time, I went to my mailbox already. It's like, yay, you finally, ventured out on your own. I told you can do it. Then that rapport it's not hard to build once you know their goal, and they know that that's what you're aiming for as well.
Yeah. I love that. Making it practical.
And
for them.
personal,
Yeah.
very personal. Yeah.
And when you work in the hospital, you don't see that end result. You just discharge the patient. Here, follow up with your home care nurse or your therapist will do that.
Right.
You don't see that when you're in a hospital setting.
Right.
Or in the home. You see progress, and it's so rewarding
Mm.
when we discharge a patient if they've walked to the mailbox or their wound is healed or they actually understand they can't eat a whole watermelon after heart failure. So, things like that. So
Okay.
it's rewarding.
Awesome. So I wanted to ask, what are some of the most unexpected challenges you faced, and how did you navigate them?
Scheduling. I don't think many adults here in Florida that are retired like to wake up before 10. So if you want to see a patient at 8 or 9, I mean, when you get that patient, you're like, yes, they're going to see me at 8:30. This is great.
I know.
Most of them want to be seen at like 10 o'clock or later. Um, Cats is for me. If you have too many cats, I'm
Oh,
like
yeah.
scratching my eyes.
Exactly.
But so yeah, I do ask about animals.
Animals, yes. It's all
If it is cats, I know to wear a mask. Also, one challenge I face is people do still smoke, and if I know that the first time, the second time the secret is a little Vicks vapor rub up the nose,
I
and
usually
you won't smell it.
Helpful tip.
Yeah, what I usually tell my patients that smoke is while I'm there, I tell them, while I'm here at your home, this is my place of work. And when I'm in my place of work, there is no smoking. So I know this is your home, but but I am allowed to have a place of work where I there's no smoking at the time that I'm visiting. You can certainly, as soon as I leave, you can pick up your cigarette if you want to, but so, and a lot of them have been very
Yeah, they
okay
are.
with that, as long as I tell them the expectation, not just with the patient, but really family members. You'd kind of have to tell them that,
Yeah.
this is, yeah, you allowed me in your home to work with you, then this for this hour or whatever, however long I'm here, this is my place of work, and
Right.
no smoking.
And I think these tips and tricks and gems are so useful to the home health people, to the home health nurses, PTs who are just starting and are listening and can use these things, because everybody doesn't know until you experience or until you hear somebody else say
Mm.
these things. So once again, we appreciate it. I'm curious, when these situations do come up or you feel like you need to decompress from a team standpoint. I know you guys kind of do everything on your own, but when the going gets tough, do you reach out to your teammates, or how do you guys still stay connected as a team? Great question.
So weekly, we have Teams meetings. If I'm having an initial issue with a patient, or I need to vent, I'll Teams message my manager, hey, you got a minute? Let's talk. And, everyone in the office is more than willing to talk to you. And we have a direct manager that has an open door and open ears to listen. Um, I know we ask questions on our Teams chat. Yesterday, I needed an ambulance transport for a patient that couldn't really afford it. So went on there. Social work answered me right away.
I love that.
So yeah, I mean, we meet in the
Mhm.
office. We're trying to
Every
get
so
back
often,
to
yeah.
going there more frequently, maybe monthly. I think they're talking about, but every week we do have a Teams meeting and we all talk about
Yeah.
the patients, but also we can hear each other.
Yeah.
Yeah, for me, it's like having been with Advent for 22 years, the transitions of leadership and all that. I've seen so many changes, but honestly, this time, this period is the best that I can say. The management is great. My manager's great. The teamwork is really, really good. I do feel a little more connected, a lot more connected now than I ever did before. I've always really felt like, okay, you got to do your thing. That's it. You do, you finish your work and you're good, but I'm definitely a lot more confident with all my coworkers. I can honestly say that I didn't feel as confident before with maybe some of the nurses, my assistants, PT assistants, but this time around, I feel like this is really a really good team that we have, and it's a lot more established, a lot of real good experiences that go into it, and we have very very good rapport with each other. I really,
Yeah.
yeah, this is the best for me. This is the best time so far ever.
Yeah. And I think the orientation process is huge when it comes to home care. You have to have a good preceptor, a
Yes.
good orientation. Because you're coming from a totally different field. So to go into home care, you need to learn about Medicare, about Oasis. That's a whole nother show.
Yeah.
You need to learn about the documentation's so different. The patient care is different. It's not as acute. So having a good preceptor really to show you the ropes, at least the first, I would say, I don't know how long the precepting process is here, but because it's been a while,
Mhm.
but yeah, if you have a good nurse preceptor, PT
I'm a
preceptor that can
preceptor.
kind of show you the ropes,
Yeah.
it makes a world of a difference on retaining those
Yes.
employees and having them really
Yes.
enjoy home care.
Right.
Yes.
Nice.
As a preceptor, definitely, I agree with that. I have had many shadow me and all that, and then so that we can really talk one on one on what I do and and how I do things.
Yeah.
So that's really really good.
Just
Yeah.
piggybacking off of you being a preceptor, I'm sure you see a lot of people come in then and you're like, oh man, this person is going to make a great home health physical therapist. What are some of those traits that you feel like make a good home health clinician?
I think is the being open minded. Being open minded because again, you are going to people's homes. You're in their turf. When I worked in acute care, they were in our turf, and they kind of were at our mercy and all that. But technically, when you're there, you are at their mercy. Even if you are providing a service, they really still technically truly call the shots, right? And so you definitely have to be a little more open-minded, and I tell them that right away. You can't just force your how you want to do things, because this is their home, and you have to always be ready for different things that could happen. Family members could come in, and so you just have to be open about certain things, be flexible in the way that you treat people also, and be kind, and of course always be thinking about your safety also. Just be thinking about your
Yeah.
safety. You can't just not just be in there and not be aware of your surroundings as well. I've had those challenges as well. Um, um, but in the overall, though, it's a very pleasant experience for the ones that I precept. They say a lot of the times that they would say, oh, it's a lot lighter than I thought it would be. It's not like because they were going into it with like a little bit anxious of what do I do if I'm by myself. But and then they say, well, watching you, and having that rapport with the patient, and being able to kind of know what to do, or answer their questions. I feel like I can do the same thing. And that's what I tell them. It's just a matter of just what you need to do clinically. It's just that now you have to also the personality wise, you got to kind of mesh a little bit.
Yeah, and you can feed off that patient. You kind of can read them, how they're going to be, and be non-judgmental. I mean, because we've been in houses that are
Hmm.
not, their environment's not the best, and it's sad. But then we've been in houses that are like, whoa, it's like a museum.
Right.
So, but you can't judge, and I know a lot of new nurses, not new nurses, but new into home care, they're like, oh, I got to go into that house. I'm like, it's how people live. And it opens your mind for me anyway, look, I'm like, wow, my house is
Patient,
actually really clean.
it's
As much as,
patient's a patient for
Right.
me.
yeah,
It's like,
it's, yeah,
yeah,
we don't
regardless,
judge.
yeah, it's a patient's a patient. So, and I always think about, my mom.
Right.
How
Yes.
would I want them to treat my mom? I
Yeah.
would definitely treat them the same way.
Yeah. No, I love that. I think I've learned so much, throughout our conversation, specifically that home care is really another avenue that you can add to your career. I think, and as someone who recruited in home health, sometimes I was met with individuals that were like, I'm cold calling, or I'm trying to get access to nurses or source nurses or therapists that I'm like, hey, are you interested in home health? And they're like, no, like I'm really looking to be in the hospital at this time. But I think if I could change anything about how was pitching them or educating them about home health, I would tell them that this is actually a different avenue or a different area that you can actually add to your resume, add to your skills as a therapist or a nurse. And I think that's what I would have changed, because I don't think the people that I was calling or the individuals I was talking to were thinking of it as that. Because what I've learned thus far is that e- even down to the EMR that you all use, or the software you guys use, being Oasis, right? Like that's something that might not be used in the hospital. You can now you as a nurse, you have the hospital software that you use, or the EMR, and now you're going to use something different, and now you just have that knowledge base of using a different system. Not only that, you're able to ask different questions and add different skills that you may not get from a hospital, not because if there's anything wrong with the hospital, but it's just the setting that you're in doesn't allow for you to tap into those skills, as a professional and as a person. And so I think that's how I would like go back and change if I was like,
Yeah.
man, I really wish I would have understood what it was really like for an individual to grow in their career through home health and through home care. I do want to ask just about
the individuals that you collaborate with. And so I know in the hospital, right, you can think of the normal individuals like a doctor, but I heard you mention a social worker. So I just want to find out a little bit more about what are some of the titles of the individuals that you're collaborating with throughout your time in home health.
So I collaborate with the physical therapist. We have occupational therapy, medical social worker, home health aide, even,
Speech. Mhm.
and speech therapy. And with speech therapy, a lot of times patients think it's just speech. And a lot of doctors, even believe it or not, think speech is just speech and swallow. They work with cognition and cognitive training. So a lot of our dementia patients would benefit from that. And those are the things you learn on the way. You learn that. And yeah. Oh, and then the office staff, we have schedulers and all the other ancillary staff that help out.
And is
Geez,
it
if
seen as co-treating?
Mhm.
Okay.
Mm.
So when you're collaborating with those individuals, for instance, like how are you getting access or understanding like kind of where they're at in the other areas?
So for me, let's say the social worker, I had one patient before who was mentioning something about not really abuse or maybe neglect from a family member, and so in the home care setting, you're the only one there and the patient, and maybe they have a son or whatever, and um, their needs are not being met by that family member, or maybe there is some sign of elder abuse or something. So then, I call the social worker right away. Hey, I have this patient that has this issue. Is that something that maybe you can check out? And and then they give you guidance right away and say, well, if you really suspect abuse, you should call DCF. Or if it's just a matter of somebody needing to kind of uh, facilitate a better way to for the patient to get resources or services, I can certainly come and visit the patient, and then they come. So there's a lot of things that may be happening in a patient's home. They have problems with transportation, let's say, or getting medications. Then the social worker is a very, very good resource to help them with that. And as far as collaborating with the other disciplines, let's say I have a patient who definitely needs to be able to get back in the shower again. I trained them to walk, and I trained them to take that step and all that, but an OT probably needs to be seeing that patient. So I would talk to the OT and say, hey, um, this patient really needs to get into that shower, and is there any way that you can work on that and all that, and they do. And so things like this, that the areas that we know that they could help with, we call them right away and say, hey, I'll pull you in, I'll ask the doctor for an order, and then they come in, and then that now the patient has a more holistic uh, uh, treatment plan, basically. So
Yep.
Mm,
So I love that. And is it fair to say that from working in home health throughout these years that you have a deeper understanding of just the human being in
ab-
general, their personal, their mindset, how to interact with different people throughout all walks of life?
yeah, absolutely. Yep, because
it's
you see you're in different homes, different, economic backgrounds, and you actually, take for granted what we have.
right.
My teenagers, they think, if their rooms, I think if their room's dirty, your room's dirty, clean it up. But then, you go in another patient's house and they don't even have as much as what my kids have, and it's like, oh wow, it it's enlightening.
Eye opening.
It's
Yeah.
definitely eye-opening, yeah, to see how other people live. And but again, you can't judge, and you just gotta be happy for what we have.
Yeah, meeting them
yeah.
where they are. Yeah,
Mm,
and I think
yeah.
for for home health, what is those that desire to join? What is if you had to leave them with just a maybe a charge or some encouragement? Those that are looking to get into home health, we'll start with you, Sharon. What would you tell that person?
I would say definitely don't be afraid, don't be afraid to go into people's homes. Make sure you have a good orientation, a good preceptor to show you the ropes. And if you have children, it's a really great position to have, because you do have that flexibility to get your kid off the bus, to get them on the bus in the morning, and then you can schedule your patients around that. And I just think it's great, and people enjoy seeing you. They are welcoming to you.
You mentioned, I wanted to just ask about the travel part of it, right? So you mentioned that you all are in certain, kind of, I guess, grouped in an area so that you're not driving, across
Oh
the
yeah.
state, right? But within the radius that you're in, if you don't mind just talking about how that works, are you guys getting paid for mileage? Are you guys getting
Yeah, we get paid mileage from our first patient to our last patient, not from our home to the patient,
okay,
not from the last patient to our home, because it would
gotcha,
be like going to work.
got you,
You don't
okay,
get paid to drive here. So, yeah, we get paid mileage,
yeah,
and
and
yeah,
then
and it's
sorry,
not being in. I'm in like Oviedo, East Orlando area. So, I mean, you're talking 4 miles, 5 miles. However, it could take 20, 30 minutes to go 4 miles.
got it,
But that's why when we schedule our patients, I give myself at least 20 minutes of that drive time.
got
I
you,
I um I tend to go a little farther at times only because there's only a few vestibular therapists in the whole Advent Health Home Health CFD. So I'm normally in the East Orlando section, but I I do go venture out a little further sometimes if there is a vestibular patient that needs to be seen. So so sometimes, I drive 50 miles, 40 miles, but mostly it's like Sharon, maybe 7 miles, 3 miles, 2 miles, So but yeah, they pay for mileage, and all of that is uh in our system in the phone. As soon as you put in your map, it tracks it for you. So you don't even have to track it yourself. Just at the end of the day, it shows you what's your total mileage. And so yeah.
there's no paper tracking,
No,
like
I
the
used to
paper
write it
charting,
down each
yeah,
time
yeah,
too.
right,
You used to
okay,
write it down
yeah,
4 miles
Yeah,
today. Yeah.
right,
No,
man,
no, not anymore. Now it's just everything is just tracked for you,
yeah.
and it's a there's it, and they also can position where you are,
right,
during the day too,
right.
Oh, and the new thing that we have is you hit start and it sends a message. Your
to the
clinician
patient.
is on the way, and
I
it's
like that.
Yes,
they
Nice
love it.
touch, right?
Like,
absolutely.
ooh,
Yes,
Yeah.
yes.
And that was going to be one of my final questions, just touching on where we were, where the home health space was to where it is now, but also to where it is 5 years from now, to where it is 10 years from now. What do you guys think that home health space looks like in the future?
I think home health is going to get even larger than it is now. I see the hospitals are sending patients home, sooner, and they're, I don't want to say more sick, but they're not as well. They're stable, but they just need them out of the hospital. And now there is also a new program, Hospital at Home, which is a whole different it's new. I think it's fairly new with Advent Health, but everything's going towards the home. The virtual visits. I mean, a lot of my patients have virtual visits with their doctors, but I think home health is growing significantly, especially since the insurances. Everything's run by insurance. Medicare. They want the patients in the home and they want them safe. That's our main thing. We want them safe in the home. So I think it's going to grow. It's definitely growing.
I think another area of home health that's definitely going to keep changing is documentation. Like I said, it has evolved from paper, to and now a lot of the things that we do are just so much more convenient. And I'm excited to see how it's going to change, 5 years from now. Let's say, how can they even improve on what we already have, So, and I hope it does improve, because even with all the improvements, there's still a lot of things that, oh, if only it was like this, but I don't have the mind to even think about how to improve on something, but it has been moving better to, so I like that. But in but if I think about, like, clinically, it's gonna always have the same foundation, at least as far as definitely with the physical therapy, because again, a patient's a patient. They need the basics. They need the basics. It's still the same. You need to teach them how to get into that bathroom. That you need to teach them how to go down their stairs if their bedroom is in the second floor. So a lot of those things which will just never change. And you have to have the basic, the foundational clinical skills to do that. But at the same time, also be thinking about how to progress them to the next level of care. A lot of our patients go to outpatient after care, and but a lot of our patients are sicker too. There's a lot of, I mean, now they're able to keep patients alive for a longer time with the same chronic conditions.
Mm.
And so we have a lot of repeat patients,
Right.
congestive heart patients that I've seen 2 years, on and off, 1 month, oh, here you are again, it's like, so they know you already, and we know them, it's like, yep, this is another time you're back in the hospital and we're back here again.
Right.
And so I think that that's going to keep going also because people are staying alive longer and the chronic conditions don't go away.
Yeah, and it's interesting you mentioned that those patients staying alive longer with the same chronic illness, but it's you all as therapists
Yeah.
and clinician job to, even with that chronic illness, to still increase their quality of life, or at least try and maintain it
Yeah,
as they
absolutely.
continue to
It's a
live longer.
testament to
Yes, and that's
Yeah.
very hard to
to the
do.
team.
Yeah, yeah,
Yeah, if
very
they
hard to
can
do.
learn about their disease, and that's what we're there, well, for nursing, we're there to teach them about their congestive heart failure, what foods you cannot eat.
Right.
They can go back in the hospital so quickly. Diabetics, teaching them how to live longer, how to have a better quality of life is the end goal, and staying out of the hospital
Yeah.
as well.
I love that. Well, Sharon, Aleta, we are so grateful for you all having this conversation with us, opening up everyone's eyes to what home health is, what it isn't, right? How you can get into home health. So I just want to encourage anyone that's listening right now, if you're in your field as a nurse, as a physical therapist, and you're thinking about home health, to give it a try, right? Give
Yeah.
it a shot. Add that to your repertoire, right? Add those skills and that experience to your career. But for now, we are so happy that you were sharing your time with us. This is the Whole Career Podcast, and you can listen to us on any platform: Spotify, Apple, Google, YouTube. Please make sure to give us a like, give us a follow, leave a comment, leave a rating. Until next time, have a great day.